MSNBC Daily at msnbc.com.
Pandemic. There is a clear message that is coming through. This is becoming a pandemic of the unvaccinated. We are seeing outbreaks of cases in parts of the country that have low vaccination coverage because unvaccinated people are at risk. The good news is that if you're fully vaccinated, you are protected against severe COVID, hospitalization, and death, and are even protected against the known variants, including the Delta variant circulating in this country.
All right, CDC Director Dr. Rochelle Walensky with a dire warning today for Americans who remain unvaccinated. She also warned that the 7-day average of new cases increased by 70% from the previous week. The number of hospitalizations has increased by nearly 40% in the same period of time, with daily deaths up 26%. Nearly all COVID-19 deaths in the U.S. are people who were not vaccinated. The uptick comes as a Delta variant. This is a highly contagious and easily transmissible mutation. It continues to spread. White House COVID advisor Jeff Zients told reporters that just 4 states accounted for 40% of all cases in the last week, and 1 in 5 new cases have originated in Florida, where Governor Ron DeSantis has proudly staked his political ambitions on dismissing the pandemic. Thanks a lot, Florida man. Unfortunately, many individuals have been receiving false and misleading information from social media or right-leaning news outlets and commentators. Last week, 11 out of the top 15 performing vaccine-related posts on Facebook were negative or anti-vaccine. President Biden was actually asked about this today.
On COVID misinformation, what's your message to platforms like Facebook?
They're killing people. I mean, it really, look, the only pandemic we have is among the unvaccinated. And they're killing people.
They're killing people. With me now is Dr. Anthony Fauci, America's favorite doctor, director of the National Institute of Allergy and Infectious Diseases, and chief medical advisor to President Joe Biden. Dr. Fauci, I'm honored to have you here with me on the program tonight, and I want to get right into it because a lot of people have a lot of questions. And I will tell you, when I come across people who haven't been vaccinated, they say, well, I've been okay so far, I haven't caught COVID, and right now I'm more anxious about the vaccine than I am catching COVID. What is your advice to those folks tonight?
I think they just need to look at the numbers that you just mentioned. 99.5% of the people who've been hospitalized and died died from COVID-19 are unvaccinated, and about 0.5% are among the vaccinated individuals. If you look at the numbers again that you just mentioned, we have a large percentage of the new infections that we're reporting every day are in those regions of the country where the vaccination rate is very, very low. It is really very unfortunate for someone to say that I have not gotten infected yet, that means I'm okay, is just not facing the reality of the high degree of effectiveness of the vaccine, the threat of the virus, and the fact that you look at the risk-benefit ratio of the vaccine versus adverse effects of the vaccine, it just overwhelmingly falls in favor of vaccination. So we really need to reach out to people, and that's probably done best by trusted messengers who they might trust to try and convince them that the folly of thinking that everything is going to be okay if people don't get vaccinated. It's going to be really a real problem. As you said, we likely will have 2 types of America, those who are vaccinated and those who are not. And the risk for those who are not vaccinated is substantial.
Yeah, it's so scary because with this Delta variant, as we talked about, it's highly transmissible, highly contagious. I know people who are vaccinated, including myself, who are fearful. Is there any chance the Delta variant can penetrate the existing vaccines that many of us have already?
Well, only if you have more mutations and you have a modification of the variant. The Delta variant, as we know now, is very, very transmissible in the sense of its efficiency in being able to go from one person to another. There's no doubt about that. It's much more than the prior viruses that we had to deal with. That's for sure. If you allow the virus to continue to circulate, namely replicate in the community, going from person to person, you give it ample opportunity to mutate more. And the more it mutates, the greater likelihood is that it will change enough to actually evade the vaccine. Right now, fortunately for us, the vaccines work very well against the Delta variant, particularly in preventing you from getting serious disease that might lead to hospitalization. So we are fortunate that we have vaccines that work even against this very troublesome variant, which all the more reason why it's stunning why people do not want to get vaccinated when you have a very effective tool that can be life-saving.
Yeah, and look, I think you make a good point. The virus is getting smarter. The virus is also something that's trying to live, and it's getting smarter. So as the virus, I think we'll keep seeing these new variants. When it comes to boosters, a lot of people, there was some confusion before about Pfizer saying you needed a booster. The White House came out and said not so fast. When will it be time for vaccinated people to get boosters?
Well, what you do is you just follow the people who've been vaccinated, and we have a number of cohorts that are being followed by the CDC, some that we're doing right now, tests to determine what the proper approach would be to doing boosters. But right now, we don't see the need to boost people. What will likely happen is that sometime over a period of time, the durability of protection might diminish to the point that it gets below that critical baseline where there would be an increased risk of the vaccine not being as effective as it originally was. Then there's also the situation of those people who are immune compromised, people who might be on medications that suppress their immunity. Also, maybe some elderly people, they may need a boost sooner rather than the general population. But we're not there yet. We're following it very carefully. And if and when and to whom we need to give boosters to, we will determine that. And when we do, then you'll hear about the recommendations. But we're not there yet. Right now, the message is the vaccines are very effective in preventing serious disease. And therefore, if you get vaccinated, you can feel reasonably confident that if you get infected, which you likely won't, but if you do, that you're not going to wind up getting a severe outcome.
I'm curious because there's a state of emergency in Japan right now where the Olympics are taking place. In your expert medical opinion, should the Olympics have been canceled?
You know, I don't really, Tiffany, I don't want to really make that determination. That really has to be done at the level of the local health authorities. The Japanese are very competent. They have very good public health people, very good physicians. We need to let them to decide that. I don't think it would be appropriate for me on the other side of the ocean, the other side of the world, telling them what they should be doing with the Olympics.
All right, well, let's talk about masks. We were all locked up for a year. I know I see a lot of people out. Everyone's ready to turn up this summer. Concerts are happening and people are social. Should we wear a mask indoors, outdoors, in Ubers, in cars with people? What's the guidance there for you?
Well, the guidance is the guidance from the CDC, Tiffany, and that is if you are fully vaccinated, you do not need to wear a mask either indoors or outdoors. But what we are seeing in the real world is that in those areas where you have a lot of dynamics of transmission and you have a situation where a proportion of the population in a particular given geographic area might be very low with regard to the percentage of people who are vaccinated. Under those circumstances, local authorities, like in certain states or certain cities, are saying, you know, even though you are vaccinated, just to be doubly sure, when you're indoors, you should be wearing a mask. But the broader countrywide recommendation is that if you're vaccinated, you're protected, and you don't need to wear a mask indoor or outdoor. But you're going to be hearing about situations where people will say, hey, if you're in an area with a high density of infection and a low level of the community vaccine, you might want to consider wearing a mask even if you are vaccinated.
Yeah. Well, thank you so much, Dr. Fauci, for providing